Welcome everyone. On behalf of Mahila Housing Trust, I am Bhavna. I would like to thank you all for joining us today for this important webinar titled Breathing Easy, Community Action and Policy Measures for Combating Air Pollution. As we all know, air pollution is one of the most pressing environment challenges facing our world today. It impacts our health, our environment, and overall well-being. This webinar brings together a diverse group of experts from grassroots organizations to government officials, academics, community leaders to discuss solutions and strategies for tackling these complex issues. Here is a quick overview what you can expect today. We will be exploring key focus areas like government measures to protect informal sector workers, residence building strategies for cities, and successful initiatives from across India. We will hear inspiring stories and practical solutions from those on the front lines of the fight against air pollution. Most importantly, we will be fostering a conversation, a chance for all of us to share ideas and work together towards the cleaner and healthier future. The structure of the webinar would be 15 minutes time slots for each panelist. We are keeping last 20 minutes for question and answer session. I am requesting all participants, please drop your questions in Q&A section, Q&A box instead of chat box. Our speakers can directly answer them in the Q&A box, and remaining questions we will take in Q&A session. Let's get started. Please welcome our esteemed panelist, Ms. Avantika Arjuna, Program Coordinator, Urban, ICLI, South Asia. Mr. Rana Sengupta, Ashoka Fellow, Director of Mind Labor Protection Campaign. Mr. Gajendra Rai, Founder and Director Research, CMSR. Ms. Zarina Begum, a CHG leader, Saudagewra, Delhi. And Ms. Hemlata, AQI Ambassador, Nandagri from Delhi. Now I would request Ms. Avantika to explain about the work of ICLI in the context of today's webinar. You can see her bio in the chat box. Over to you, Avantika ji.
Thank you, Bhavna ji. I would like to thank Mahila Housing Trust for this opportunity. I'm really happy to be a part of the webinar today. Before I start, I would like to introduce you. You've already seen my bio. I'm Avantika Arjuna. I work with an organization called ECLA South Asia. We are an NGO. We are based in Delhi. And we work with city governments, more than around 2,500 city governments we've been working with. And our main focus is on mobility, solid waste management, biodiversity, energy, water conservation, and also children. We work a lot with women and children because considering these to be the most vulnerable groups, our focus is a lot on children and women through our projects. The list which I mentioned about mobility, solid waste management, biodiversity, energy, water conservation, child friendly cities, all of these you would understand that they have a lot of focus on air quality improvement. If we talk about mobility, if we talk about solid waste management, so we understand that mobility, the transport sector creates a lot of emissions. And we've been working a lot in the mobility sector. Similarly, solid waste management sector, a lot of pollution, air pollution is created through solid waste management as well. So the actions which we take and which we work with the city governments, I mean municipal corporations or municipalities, we help them make action plans, and also sometimes based on our projects, we help them to reduce emissions from these sectors, which ultimately helps in controlling air quality, improving the air quality. Similarly, biodiversity and other sectors as well. Now, moving on to my next slide, since we have a short time of 15 minutes, I would come directly to the topic, today's topic, since we've been asked to present our inferences from air quality projects. So I'll just focus on the air quality project which we have done. When we, I'll start with when we think about air quality, especially in Indian context, we see that air quality, not only in Indian context but otherwise also, if we see, we know that air quality, it air doesn't has any control or it doesn't has any jurisdictions. मतलब जैसे भी एयर होती है, इट कैन मूव टू रूरल एरियाज, इट कैन मूव टू अर्बन एरियाज, देयर इज नो jurisdiction. जैसे हमारा म्यूनिसिपल कॉर्पोरेशन का एक बाउंड्री रहता है. So there are different stakeholders which are involved, which work under air quality. So you can look at this slide where we see in Indian context, we have central government, we have CPCB, we have various other commissions, we have different departments which work in India for improving the air quality. Similarly, when we move down to urban and rural areas, when you talk about urban areas, the focus comes down to municipal corporations and city governments. And when we talk about the state government, it definitely includes urban areas as well as rural areas. But we at ICLI, our focus is more on the cities, city governments, and municipal corporations. But as I said, along with this, these stakeholders, there are other stakeholders also which work on air quality. Besides the government institutions which I mentioned, there are research institutions, there are different multilaterals, bilaterals, there are NGOs, and besides that, there are a lot of CSR opportunities, the corporate social responsibilities, which the sector, they have a lot of mandates to improve air quality. So through our project which we did, I would like to share some experiences that how has the CSR opportunities helped few cities to improve their air quality. Now I'll come to the project. So this project we did in Delhi NCR. This was started in June 2021, and this was a project which was supported by Clean Air Fund. And the major aim of the project was to support municipal corporations in Delhi NCR. You would all understand that Delhi NCR is one such area. If we talk about our Indian, if we talk about our country, there are in the northern region, especially during the winters, I would say not only in winters but nowadays even in summers, the air quality becomes really very poor. So the mandate of this project was that we wanted to support four municipal corporations in Delhi NCR area to improve their air quality, to help them strengthen the work which they were doing under air quality. And we had detailed out few objectives regarding that project. So the majorly those objectives aimed at building the capacity of the city governments, also improving their knowledge, and in addition providing a platform to different actors I just mentioned above, different stakeholders. Because when we talk about air quality, it's not only municipal corporations or municipal staff who is responsible for air quality improvement, but there is a set of different stakeholders who are involved in it. So as a part of our objectives, that was also a major aim to provide a platform to these different actors so that they can interact with each other and understand that how could they work together to improve their air quality. So now I will talk about the project cities which we chose. So since I mentioned that they were as a part of the mandate, there were four municipal corporations. So we worked with South Delhi Municipal Corporation, East Delhi Municipal Corporation. But while we were working with these corporations, then again the Municipal Corporation of Delhi again unified. So we worked as a throughout our project, we worked with Delhi Municipal Corporation. Besides that, we also worked with Meerut Municipal Corporation and Gurgaon. So today in today's presentation, I would like to focus more about our learnings and our focus from Meerut and Gurgaon. So this is now coming to the next slide. I hope my slides are moving. Coming to the next slide, this is the methodology which we chose for selecting these cities and what all actions we took in each city. Basically, we floated EOIs that was to seek interest from these cities. I would also like to mention that since all of us, all the audience here it seems that they have interest in air quality. That is why they have joined the webinar. I would also like to mention that the cities which we were working on, and the Indian government has given mandate to few of the NCAP cities, basically National Clean Air Program, and also the government also gives funds to few cities which are through its 15th Finance Commission to improve their air quality. So, based on our methodology, which we had tried to work out, we identified these cities, out of which Meerut and Delhi were the cities which were under NCAP. But Gurgaon, being one of the cities, though it faces a lot of hurdles and a lot of issues due to air pollution, but it's still not an NCAP city, because at the time when non-attainment cities were being chosen, that time the pollution level of Gurgaon was not that bad. But so still it's not an NCAP city. Now coming to Gurgaon. As I already mentioned, that Gurgaon is not an NCAP city. So Gurgaon is taking a lot of initiatives on its own to improve its air quality, mostly through CSR funding as well. So I will now come down to the projects where we had tried to help Gurgaon in improving their air quality. So the first one was Gurgaon. So basically, in Gurgaon, we worked with Gurgaon Metropolitan Development Authority. uh, the first project was they were wanting to install few air quality sensors in Gurgaon, because the air pollution levels were increasing at a very high rate. So they were wanting to float this tender. So they had asked us to help them identify few areas which had maximum air pollution. So we did one study in 4 locations, which included metro stations, and we used a low cost air quality monitoring device that you can see in the picture over there. And we tried to study the different levels of air pollution in at those 4 locations, and we were able to find out that in all those 4 locations the air quality was really poor. I would also like to mention that in the year 2021 to 2022, after doing the analysis of the CPCB data, there were only 60 to 65 days in Gurgaon which stated that air quality in the city is at a satisfactory level. But besides that, all the remaining days, there were the days all the air quality was not at all satisfactory. They were lying in poor zone if you would look at the AQI index. So the study which we did, we were able to identify the 4 locations. So they were also coinciding with the hotspots which the city had identified, and we were able to identify those 4 locations, stating that the PM level and SO2 level in those 4 locations were really very high. The reason being was that there was a lot of traffic in that area. Besides that, because it was a metro station also, there was a lot of parking and lot of traffic and lot of congestion was there. So we were able to identify those 4 hotspots and help the city to use them as a part of their tender. Next, I would like to tell about the another project which we tried to help them. There's a Gurgaon has few open spaces, and there are 4 major parks in the city, and Tau Devilal Park Biodiversity Park is one of the major park where we had. And as you would all understand, in the beginning also I mentioned that uh, biodiversity, mobility, solid waste management, these all are different sectors which contribute to air pollution. So they are kind of interrelated with each other. So as a part of our improvement exercise, we tried to, because biodiversity and horticulture is also one of the sectors on which cities work to improve their air quality. So in Tau De Vilal Park, we help them identify different native plant species which were existing in the park. Initially, they were just trees, but there were no records. There were no detailed records. So we helped the city identify which were the list of the native trees, so that they could use the native trees in further plantation. And we also helped them identify the trees which had higher APTI. APTI means they were able to tolerate pollution, that's called air pollution tolerant index. Besides that, we also developed a green cover map for Gurgaon city, so that the city is able to identify which areas are greener areas, which are the roads which need, and from there they will be able to identify the roads or the patches which would need plantation, and also open spaces, etc. Besides that, there were different. The city was trying to develop open areas, develop plantation, enhance the green cover based on the green cover map which we prepared. We also help them identify different and identify and connect them with different NGOs who were working on plantation activities, so that the city is able to utilize their existing land. They identified suitable lands, and we tried to connect them with different NGOs who were doing plantation. And the city was also trying to work on a system called misting system, so that they were which they were wanting to use the treated water through that misting system to control the dust pollution along the roads. So we also tried them help work out that system. Besides that, in Gurgaon, there were a lot of outreaching activities in terms of air pollution. How could different stakeholders, including the residents, including the children, including waste collectors, kind of awareness activities, we try to conduct those activities for the cities. I think the picture on the right is one of those activities. I will move to the next slide. Again, these pictures, you can see the different outreaching activities which were done for Gurgaon, which include, these are all capacity building activities for solid waste collectors, so that because they go and collect waste, and they are able to inform the people that why is waste segregation important and why burning is not supposed to be done. That all kind of information and awareness campaigns were created, were done through this project. Now, quickly coming to Merit. Merit is one city which is NCAP supported. Okay, before coming to Merit, I would want to just highlight one thing in Gurgaon. Like I said, that Gurgaon is not an NCAP city. It doesn't receive any funding for improving its air quality. But I would like to mention that they've taken a lot of initiatives in terms of installing uh, air quality monitoring systems, air quality low cost monitoring systems, though all of them are not all the time working. But I guess a lot of CSR support has been coming to the city to improve their air quality. That seems to be a good initiative, which could be replicated. I think it's a good learning, which could be replicated in other cities as well. Now, I would quickly come to Merit. So in Merit also we did a similar study for using this low cost air quality monitoring sensor. But in Merit our approach was little different, because the municipal corporation wanted us to do a study how what is the difference in pollution levels in a slum area, how is it different in at a traffic junction, and how is it different at a hospital, outside a hospital, because hospital being, if it's highly polluted area, it definitely affects the patients coming. So we did a study over there as well at three different locations, and came up with different strategies and presented that to the municipal corporation. Besides that, for Merit, we also, because as I initially also mentioned, that solid waste also, being one of the sectors, contributes a lot to air pollution. If we do not handle our solid waste carefully, then a lot of air pollution is caused. So what we did was that in one of the localities, which is called Shastri Nagar, um, we tried to develop a composting plant over there, with an aim that waste going to the landfill site gets reduced. And you can see in the picture on the right side, that's a compost plant. With the help of a solid waste management expert, this was developed. And actually this is a refuse bin, which was a kind of a junk in the municipal corporation, which was developed as a composter. And a pilot exercise was done with this. So this helped saving a lot of emissions which would have otherwise gone to the trucks, or would have taken to reach the municipal landfill site. In addition, when this was done, municipal corporation really liked the idea, because there was a fire at the landfill site, and they really wanted to reduce the waste going to the landfill site. We did a study, and we did the study, helped municipal corporation carry this out, and also as part of outreach activity with the citizens of that area, of that society, we tried to explain them how are they supposed to segregate the waste, and what benefits it could bring to the city and to their society. So this now coming to the next study which we did in Merit. This was again a pilot study which was a part of the transport exercise. We did a study of a junction and tried to find out how many the number of vehicles which were passing from there, with a major focus on e-rickshaws. This junction is called Hapur Adda Junction, and there were a lot of e-rickshaws which were there, and they were causing a lot of nuisance, which was leading to traffic congestion of the buses which were going over there, which was ultimately leading to air pollution. So we tried to develop a routing plan for them so that ultimately the e-rickshaws could follow a specific route, which and the buses could take another route, and which could further definitely help in reducing the air pollution of which is caused due to traffic uh, or transport sector. Besides that, at Merit, we also tried to help them with their prana exercises, prana portal, develop data, coordinate lot of do coordination with different stakeholders, develop proposals for utilization of funds under air quality. And as I mentioned, for Gurgaon, similar activities were done for Merit as well. These are for educational institutions. We also did one exercise awareness campaign for improving green cover in Merit. And I guess these are the pictures in which you can see different stakeholders from different organizations, the Pollution Control Board, private companies, and NGOs working with solid waste management. They were all a part of these outreach campaigns. And I would also like to mention that the solid waste management project with which we worked with the Shastri Nagar Society, there we also worked with local NGOs. So that because local NGOs really work on the ground and we got assistance from them, we also involved students to help people understand that what is the difference between what is the need of segregating the waste and how they could do that. I think that was the reason that it helped in becoming successful. Yeah, so these are again different outreach activities. Again, these are capacity building activities with school students. We also developed content for social media alerts, air quality, on air quality. So now these are the I would like to mention about the knowledge products which have been developed under the project. One is on air quality communication, that's called air quality communication manual. You could see this on our website. So this is basically about this talks about how the municipal corporations could communicate to the citizens regarding air pollution. If the air quality is really bad, what could they do to inform citizens? Next is about the learnings report, which has been developed under this project. It's about learning our learnings from all the three cities. And our recommendations for the project. I would urge you to look at our website and you'll get more details about the project. Now, quickly coming to the findings of the project, I would like to mention that when we worked in all these cities, all the three cities, every city, we were able to understand that every city follows a different structure for air quality, a different institutional structure for air quality. Though, and one major thing was that the cities do not consider air quality as one major sector. I think that is something which is missing, which we need to look at. If you need to work on air quality, it's usually how it happens is that there's a separate transport department, there is a separate horticulture department, there is a separate solid waste department, and many others. But as a whole, it is not being considered as a one sector. I think that is one thing where a thought has to be given that how should air quality be considered as a one sector, so that a sectoral approach should not be followed, because it is very important that that cities work together to improve air quality as it is affecting the health. Second is exploring CSR opportunities. As I already mentioned, that what we came to know from our project was Delhi and Gurgaon are one other cities where a lot of CSR opportunities are existing, and that's really very good. But from Merit, we could see that though the cities was very much interested to improve their air quality, and they were getting funding under NCAP, and also they were getting funding under 15 Finance Commission, but CSR initiatives partnerships do not exist in Merit. So I think it is very important that not only the metro cities, maybe like Delhi, Mumbai, or Gurgaon, should are getting CSR opportunities, but it is very important that similar opportunities should go even to smaller cities as well. To maybe to Merit is one, but there are many other cities in India which face a lot of issues due to air pollution. But these learnings from bigger cities should be replicated in the smaller cities. Next finding was that we found that NCAP, which was a very good initiative by the government to reduce pollution, air pollution, but I guess that focused majorly on reducing PM values. But it is important to understand that there are different sources of air pollution, which should not be neglected. Equal importance should be given to them as well. And another thing which we found out was that collaborating with educational institutions is very important. You would see that there are different educational institutions, planning institutions, which are working on different sectors, but there are none or very less who are working with cities on improving air quality. But this is one discussion and we held one discussion with, as a part of our work, we held a discussion with the planning institutions in Delhi NCR and along with the cities, and they were all very open to take this further. And also, besides this project, I would also like to mention that we are working in Ahmedabad, in Gurgaon, ICLE South Asia. We are one of the project management units over there, and we've been working with the city on different other projects also, but we also work on air quality, wherein we assist the city government, Ahmedabad Municipal Corporation, in all the activities which they do related to air pollution. And few of our activities have also helped to bring down the PM values in the city. That is one. And quickly, just this is my last slide. I would also like to mention about other projects which also include a part of air quality. We've been working a lot with young children meaning the children which lie in the age group of 0 to 5 years. So we have conducted studies. Our major focus has been Udaipur till now. We have developed different spaces for children with a point of view, thinking in mind that how could air be considered, and how could better air quality and better life quality of life could be given to young children, pregnant women, and their caregivers. So these studies, I would urge you to please look at our website. They are still not on a website, but I would urge you to look at them. Maybe in few days this will be on our website. These are really very interesting studies about air quality and young children. Yeah. I would stop here, and in case you have any questions, my email ID is also there. I'm happy to get back to you. Thank you. Thank you, Bhavna ji.
Thank you so much, Avantika ji. It was very comprehensive presentation, and it's good to know about the NCAP and non-NCAP cities difference from your presentation. And the government is taking like initiatives to address the issue of air pollution. And once again, thank you so much, Avantika ji. Now I would request Mr. Rana Sen Gupta. Uh, please share about the impact of air pollution on health, and that too specifically the air pollution from mining sites, the status of government policies, and recommendations to strengthen it further. Over to you, Ranaji.
Okay, thank you, Bhavna ji. Am I audible?
Yes, yes.
Okay. So I'm Rana Sengupta. I'm a master's in social work. I've done my PhD on the supply chain of natural stones and fair trade standards. And I also pursued my law because the work which I am doing in regard to the mine workers to secure their health and safety and their welfare, it needs a little bit of policy advocacy. And this is like I have been working on this issue for almost 2 decades. I started this organization in 2007, but I was working with this organization prior to that also. So the organization is focusing basically on the mine workers, their health, their rights, and their welfare in Rajasthan. So the issue why this is important is it is all in almost all the states of the country where mining is a state subject and the labor in mining is a central subject. So if you see who will take care of the workers, if it is the revenue, then it is the state who is taking its share from the mineral. But if you talk about the workers, then they are vulnerable because they fall under the purview of the central government, and the central government doesn't get any tax from the mineral which the state is extracting. So without any funds, it is impossible to ensure welfare of the workers because welfare needs funding. The issue of air pollution in this particular segment is with regard to occupational health and safety of the miners. There are approximately 30 lakh workers in the mining sector of Rajasthan, and there are 33,000 mines. So it is the second largest employment sector. So in the recent almost 15 years back, we realized that most of the mine workers are deprived of their rights and they have been diagnosed for tuberculosis. So tuberculosis being a communicable disease, and silicosis is a disease which happens because of the exposure to silica dust. So because of lack of awareness and also lack of knowledge among the doctors to diagnose or to distinguish between both the disease, most of the workers were given symptomatic treatment for tuberculosis. And later on, it was found that it was not it was not TB, it was a disease which happened because of the exposure of the dust. So this is not because I'm sharing this because this is not just confined to what has happened in Rajasthan. It is happening in Gujarat, it is happening in Madhya Pradesh, it is happening in various other states of the country. But unfortunately, because there are not much organizations who have raised the issues very strongly in front of the government, the situation has not improved. So there's a very thin layer of distinguishing between an occupational disease and a TB. So where TB is treatable, but silicosis is not. There is no cure for silicosis. It is the most ancient disease in the world. And it is preventable, 100% preventable. But because workers are those people who are uprooted from the rural economy, they have less occupational scope. Their basically livelihood opportunities are less for them. They get into mining and they do this muscle breaking job in the mine and they get exposed to the dust. What has happened in the years is we have understood that the National Tuberculosis Control Program should understand what is the distinguishing between how to distinguish between silicosis and TB, so that these cases can be detected at a very early stage and they should not be misdiagnosed or mistreated for tuberculosis. So the silicosis patients, as they are vulnerable, they already have damaged lungs, they are prone to tuberculosis, and where they go for treatment is a TB hospital, where they become silent carriers of the bacteria or the disease. So unless and until silicosis, a disease which is happening because of the dust, is controlled, the National Tuberculosis Elimination Program will never become successful. So this is a message which I want to take it forward through the platform. Not just only this platform, I have been taking it with every possible platforms, that the central government should now understand, to secure the occupational health and safety of the workers across the country, they have to have a scope of bidirectional tests in the TB control program, so that anybody who is coming for a TB checkup or suspected for tuberculosis should compulsorily be diagnosed for silicosis, so that you know where the problem is happening. So what happens when you are diagnosed something like silicosis? It is a notified disease and it is a compensable disease. So if it is a notified disease, then there are regulatory mechanisms, there are regulatory frameworks where you need to notify them for regulatory authorities to come in and check where is the pollution happening. So if you don't check where the pollution is happening, then there are several thousand people, not just direct, but secondary exposures would also be there, because it's a dry area. If it is sandstone, which is everywhere in the country, most of the parts, then that area would be dry and the air carrying capacity is high. So it will go and affect many people in the surrounding areas. It won't discriminate between rich and poor, mine owner or a mine worker, anybody who is in the transport of that particular mineral, whether the schools in the vicinity or the settlements, everybody will be coming into it. Sooner or later, direct exposure, 5 years, indirect exposures after 10 to 15 years. What happens if you get diagnosed after 15 years? You don't get any entitlement for any compensation under workman compensation because the latency is higher. You have crossed the limit of 10 years within which you should have filed the cases. So after a long struggle, finally in 2009, we found that 48% of the women workforce in the mining industry are widows of silicosis. Filed a complaint with the NHRC, and there was a case going at the Supreme Court where Prasar versus Union of India. So it was NHRC which was designated in this particular Supreme Court case. So NHRC did a visit and they found out that yes, the problem persists in Rajasthan, in Jodhpur. And that's where, because of the intervention, the government had to pay monetary relief. So it was not just to the 22 widows who were there in the first agitation, but it was found that more and more people were there. So finally, from 2013, when the first monetary relief was given, until 2018, Rajasthan government became the first state to list this disease as an epidemic. After listing it as an epidemic, the state found that there's a need to establish a policy to address this issue. So we became the first in the country to have a pneumocnosis policy, which was not just for silicosis, but other pneumocnosis-related diseases. So this is 2024. So what has happened in between this years? So a disease which is preventable, which has and the pillar and this particular uh, policy, which talks about prevention, detection, and rehabilitation. I'll come to the detection part of it. Most of the doctors have been trained. There have been specialized doctors designated in every district to diagnose silicosis. There is a portal, digital portal, where you can go and opt for a diagnosis and you get all the thing done very smartly and even to an extent that AI is being used. So the policy, as an outcome of the policy, I'll give you some statistics. Over 1 lakh people have been registered for screening of silicosis, 1,07,297. 31,504 people have been diagnosed when they were alive. 9,950 cases diagnosed for silicosis and they died. 17,309 families have been given 519 crores as monetary relief. So we are the state which has given the highest and the largest money that they could to the silicosis patients. The children, around 22,327 people, children have been enrolled with schemes which they could get entitled to. And as of today, 32,517 people are getting pension. This pension is around 1,500 rupees per month. There are approximately 11,084 widows of silicosis who have been given monetary relief. And all the 38,000 people who are now surviving get NFSA benefits, that is the subsidized food grains. In terms of the rehabilitation, it is only the money that has been given, but nothing as such, because as in a country like India, where only rich people can afford a rehabilitation plan, it is very vulnerable and it is very difficult also to have a rehabilitation plan for all the workers who are suffering. Now, these figures which I have shared with you is after 2019. So imagine what has happened before 2019. Hundreds and thousands of people would have got exposed to this dust and they would have been misdiagnosed for TB. They have died on record, but there was no mechanism to prove that they were suffering from silicosis, so they couldn't get their justice. This would happen in most of the parts of the country where silica content minerals have been extracted. Now, what can be done? It is only prevention, which can save these lives of the people. And for the prevention, I'll share you a video later on after my present at the end of my presentation. So it is not compensation, it is not monetary relief, it is not rehabilitation that is going to help for a disease which happens because of the air pollution, but it can always be prevented. Coming back to what we are doing, we are helping people to be rightly diagnosed. We are advocating the government to have a national policy where they can diagnose silicosis at a very early stage so that do not have to be misdiagnosed or suffer or shock for doctors from year to day, because most of the people will go to Gujarat for the rightful diagnosis, get some relief, come back, and then again get into the trap. By then they are already indebted. Their families are gone. The families are already into a slavery. They are forcing the children to work. The women who never worked in the mines, they are out to work in the mines because they have already taken money for the treatment. We do run oxygen banks because what they need at the last hour is oxygen, because that is what is the breathlessness among these workers. What we do is pulmonary rehabilitation. We have yoga, we have pranayama, we do some exercises regarding their lung function and improve their lung breathing tests, breathing situations, and also try to see how we can improve their quality of life. Finally, in terms of, because we are a small organization trying to focus only on mine workers' rights and health, we could try to establish a machinery which can prevent silicosis. And I will ask Bhavna ji and her team to please help me with 3 videos that I'll share shortly, because this is also an answer to or a remedy to the problem. Okay. The
Yes.
first one, which will show how the dust happens in a sandstone mining. Bhavna ji, over to you, please.
Yes, yes. Chetna, could you please share the video? Chetna, ma'am?
Make के विंडो स्मॉलर आई थिंक विंडो छोटा कर दो इट्स नॉट कमिंग
Requesting Ramesh bhai, could you please check and help the Chetna? Yeah. Just give me a minute.
Oh, sure. Please take your time.
I'm so sorry for the inconvenience.
Just imagine if you would have asked me to do.
That is why you have asked MST to share the video.
I know this happens.
Meanwhile, Rana ji can respond to a couple of
भावना
questions
बहन
which has
देखा
been
तो
posted
नहीं
on question and answer
हेलो
section.
No, Chetna.
In the meanwhile, you can please ask me the questions, whatever you want to.
Definitely. Then, Rana ji, the Rajasthan government policy that you mentioned talks more about response and rehabilitation. But what steps have been taken to prevent silicosis? Are preventive measures taken by mine companies now?
भावना जी, इसमें ये जैसे कि नोटिफाइड डिजीज है, एपिडेमिक में आ गया है, तो नोटिफाइड डिजीज में अगर आप नोटिफाई नहीं करते, जैसे कोविड हुआ और आपने नहीं नोटिफाई किया, तो आपके ऊपर एक्शन हो जाएगा। ठीक है ना, क्यों? आप बीमारी को फैला रहे हैं। ठीक है, तो इस तरह से जो एपिडेमिक में आता है उसको, और एपिडेमिक में भी के अलावा भी बहुत सारे डिजीज है, कम से कम सिलिकोसिस तो नोटिफाइड डिजीज है
जी।
और यदि आप अभी का कानून पढ़े, जिसमें कि जो ऑक्यूपेशन हेल्थ कोड बना है, अगर आप डायग्नोस कर रहे हैं, सर्टिफाई कर रहे हैं और आप नोटिफाई नहीं कर रहे हैं टू द
जी।
रेगुलेटरी अथॉरिटी, तो आपके ऊपर में 10,000 का पेनल्टी है। तो
ओ,
सोच लीजिए कि अगर 40,000 लोगों को आपने डायग्नोस किया है, इंटू 10,000 रुपीज, मतलब डॉक्टर के ऊपर कितना बड़ा पेनल्टी आने वाला है अगर लीगली चले जाए तो। ठीक है ना।
जी
पर
जी।
बात यह है कि जब सरकार सुन रही है तो फिर लीगली जाके उस डॉक्टर को जेल में डालने से या पैसा लगाने से फायदा नहीं है। पर अगर वो नोटिफाई नहीं करता तो क्या होता है, वो पेनल्टी वाला पार्ट अगर हम भूल जाते हैं, लेट्स लीव दैट, that poor fellow is deprived of the rightful diagnosis and also the rightful compensation. उसको 14 लाख मिलता, वो बेचारा अब भीख मांग के लोगों से उधार लेके जी रहा है। ठीक है, तो वो 10 हजार को तो डॉक्टर को कोई फर्क नहीं पड़ेगा, लेकिन ये आदमी का जिंदगी और इसका पूरा परिवार बर्बाद हो गया। सो दैट इज व्हाट इज नोटिफिकेशन। तीसरी बात यह है कि अगर आपने वो अथॉरिटी को नोटिफाई ही नहीं किया जिसको पता चलना चाहिए कि यहाँ पे बीमारी है, तो वो आपके प्रिवेंट कैसे करेगा? तो जैसे कि मैं कहता हूं कि अगर चोरी हुआ है तो आप एफआईआर दर्ज कीजिए, वरना पुलिस को पता नहीं चलेगा कि चोरी हुआ है। इसके कारण से इफेक्ट क्या होगा? आपका चोरी हुआ माल कभी मिलेगा नहीं और वो चोर रुकेगा नहीं। Exactly, this is happening with the policy. The person who has been diagnosed is deprived of the rightful compensation, and the disease is not stopping because जो कर रहा है वो कल भी कर रहा था, आज भी कर रहा, कल भी करेगा। अब जो क्यों सरकार नहीं रोक रही है, वो सरकार की इच्छा क्या है नहीं पता, बट दे आर द ब्रेड अर्नर्स फॉर द गवर्नमेंट। वो सरकार को शायद रेवेन्यू का चिंता हो रहा होगा, लेकिन अब जब सरकार का खजाना खत्म हो रहा है, तब सरकार को पता लग रहा है कि अब देंगे कहां से। अब अगर नहीं दिया किसी को और सिर्फ सर्टिफाई कर दिया तो वो कोर्ट चला जाएगा। तो ये बात है कि नोटिफाई क्यों नहीं हो रहा, जबकि अगर हम आप हमारे सिलिकॉसिस पोर्टल देखेंगे गवर्नमेंट का, उसमें आप जांच के लिए जाते हैं, इमीडिएटली आपका नाम दिख जाएगा विद इन 2 मिनट्स कि यू हैव अप्लाइड। आपको विद इन 5 मिनट्स एक डेजिग्नेटेड हॉस्पिटल मिल जाएगा जहां आपका लिए डॉक्टर वेट कर रहा है। जिस दिन आप गए वहां पे विद इन 6 आवर्स डॉक्टर का डायग्नोसिस अपलोड हो जाता है। ये पूरा डिसबर्समेंट तक का ट्रांसपेरेंसी और डिस्क्लोजर है, बट व्हाट दे डोंट डू इज नोट दे डोंट नोटिफाई इट। तो हम लोग चाह रहे हैं, सरकार को कह रहे हैं कि अगर आपको कोई वजह नहीं है कि आप उस व्यक्ति को इस हालत में ले जाओ, उसको तो छोड़िए, उसको तो हो गया जो हो गया, पीछे जिन लोग को होने वाला है उनको रोकने के लिए, दैट इज द वर्ड प्रिवेंशन ना।
राइट।
And what I'm saying is not just Rajasthan. It is not just Rajasthan. ये 20 साल अपने जिंदगी का दे दिया तभी हम यहाँ तक आके बात कर रहे हैं। ये आपके राज्य में भी हो रहा है, एमपी में भी हो रहा है, महाराष्ट्र में हो रहा है, हरियाणा में हो रहा है, वेस्ट बंगाल में है, छत्तीसगढ़ में है। ये जो बेल्ट है जिसमें आपको स्टोन बेल्ट दिखेगा, उसमें सब जगह पे है।
जी जी।
तो ये है।
ओके।
वीडियो है अभी आपके पास में?
स्टिल आई थिंक दे आर ट्राइंग, बट मीनवाइल ऑलरेडी हमारे पास 2 सवाल आ चुके हैं राणा जी आपके लिए।
हाँ हाँ।
व्हाट
अभी आप लोगों को स्क्रीन भावना में स्क्रीन देखाई है?
यस,
शेयर करूं
स्क्रीन दिख रही है आपकी?
तो वीडियो ऑन दिख रहा है?
यस।
अब दिख रहा है। तो आप देख सकते हैं कि एक मशीन, जो इसको बोलते हैं जैक हैमर, इससे आप ड्रिल करते हैं और उसके बाद में एक टार होता है जो एक्सपेंडेबल टार होता है, उसको आप डालते हैं तो वो स्टोन क्रैक कर जाता है। अब ये जो डस्ट हो रहा है, ये अगर मैं भी वहां पे खड़ा हूं, ये डस्ट किसी को छोड़ेगा नहीं।
राइट।
ठीक है, और ये आदमी जो खड़ा है ये तो सबसे पहले मरेगा जो ये कर रहा है, पर इसकी मजबूरी है। ये टूल वो अपने घर से लेके नहीं आया है, इसको प्रोवाइड किया गया है। अब इसी टूल में अगर आप कोई एक अमेंडमेंट करते हैं तो वो अमेंडमेंट में ये प्रॉब्लम रिजॉल्व हो सकता है। और वो नेक्स्ट वीडियो अगर आप दिखाते हैं तो दिस इज अ स्मॉल डिवाइस अटैच टू द सेम मशीन। ओके, ये यही कर रहा है कि ये जो छोटा सा पीस आपको दिख रहा है ब्लैक वाला, वहां पे वो सक्शन हो रहा है डस्ट का। जिस तरह आपका वैक्यूम क्लीनर सक्शन करता है, वो सक करके इस मशीन के अंदर डालता है। इस मशीन का थर्ड वीडियो दिखा दीजिए। इस तरह से सक करके इस बैग में लेके जाता है और जो डस्ट है वो उस नीचे वाला बैग में इकट्ठा हो जाता है, कुछ अंदर फिल्टर्स है उसमें भी इकट्ठे हो जाते हैं। तो ये एक डिवाइस है विच वी आर मैन्युफैक्चरिंग, वी आर डूइंग आवर R&D ऑन दैट, और इसको हम डेमो कर रहे हैं। इसका कॉस्ट इज नॉट मच मोर, मतलब ये 70,000 रुपए का है, 70,000। सरकार आज 5 लाख रुपए दे रही है किसी को सिलिकोसिस हो जाता है तो, और प्रिवेंट 70,000 में हो सकता है। बट ये है कि एनफोर्समेंट कौन देखेगा? ये 70,000 का मशीन किसी के लिए लेना कोई बड़ी बात नहीं है, पर आप लोग जानते हैं कि हम इंडियंस को जब तक दूसरा भाषा नहीं सिखाया जाता है तब तक हम हेलमेट भी नहीं पहनते। तो वो एक मतलब हम हेलमेट पहनते हैं क्योंकि रास्ते में कोई हमको पकड़ नहीं ले। तो वो पकड़ा चोर पकड़ने वाला खेल करेंगे तो शायद ये थोड़ा इम्प्रूव हो पाएगा। अदरवाइज गवर्नमेंट को देखना पड़ेगा। गवर्नमेंट को जिस तरह वो व्हीकल्स बैन किया है उन्होंने जो पॉल्यूट करता है, गवर्नमेंट ने बहुत सारे केमिकल्स बैन किए, मेडिसिन बैन किए। गवर्नमेंट अगर चाहेगी तो ये कंप्रेसर्स बैन कर सकते हैं। गवर्नमेंट ये कंप्रेसर्स इनको फ्री में दे सकते हैं माइनिंग एरिया में कि यूज करो, क्योंकि ये घर ले जाके कुछ करेंगे नहीं इसका। एटलीस्ट यू इफ दे पुट अ बैन एंड फोर्स देम टू यूज दिस, तो ये शायद प्रॉब्लम रिजॉल्व हो सकता है। आई एम डन, थैंक यू सो मच।
Sorry, we are running bit late. So
नो
हम
इट्स ओके।
क्वेश्चन एंड आंसर लास्ट में, आई एम रिक्वेस्टिंग ऑल पैनलिस्ट के जो भी पार्टिसिपेंट्स ने क्वेश्चन Q&A में डाले हैं तो यू कैन रिस्पॉन्ड देम डायरेक्टली so that we can save the time. Anyway, thank you so much, Rana ji. Actually, your talk and your presentation was very informative, and you very rightly identify issues faced by mining workers, which generally goes unnoticed when we discuss issue of air pollution. And of course, you shared about the mineral policy and mine policy. And lastly, issue faced by silicosis patient when they are categorized in the group of TB patient. Really, it was very sad to hear all the numbers like shared by you. Really, it was very sad. But anyway, we are going ahead, and now I would like to request Mr. Gajendra ji to share the insights of the landscape study focusing on government protective measures. Over to you, Gajendra ji.
Thank you, Bhavna ji. So can you see my screen?
Yes, yes, your screen is visible.
Sure. Thank you. So first of all, thank you very much for this opportunity, Bhavna ji. I'm truly delightful to be here today. And for those who may not know me, so my name is Gajendra Rai, and I'm Director Research at CMSR Consultants. And CMSR is basically a research think tank founded in December 2011. And since then, we are into social research, policy research, communication research, and carrying out all sort of impact assessment activity, whether the long intervention, impact assessment of long intervention projects or CSR project impact assessment. So as a part of this process only, basically, we had the opportunity to conduct the landscape study for MST, and I'm going to talk about the findings of the landscape study within the limited time that has been given to me. So just 1 second. Yeah. So before I get into specific findings of landscape study, let's understand a bit about the community context. So who are the informal workers? So the individuals who are basically working in the sectors who are not basically formally regulated, or there is no as such like law, laws to protect them, any fixed regulation to protect them. So those are the informal workers, and we understand that, there is a impact of air pollution on our health, and all of us are being impacted by that. But this informal community, they are disproportionately affected by this, and this is largely because their nature of work, their exposure to the work site, their housing, poor housing condition, their poor access to healthcare facility. So impact on them are really very high as compared to all of us. But the sad part is that they themselves consider it, they do not basically consider this as a priority. They consider it as a occupational hazard, and they believe that this is something impacting all of us. So why? So this is not impacting them only. And this is the reason that we can see that they have very like less interest, or they basically remain absent from any decision making process, and even they fear that if they will take action, they might have, they will have to compromise on losing their job. So yeah, and so why this? Just give me a second. So why this landscape study? So this was basically the landscape study. Basically, it was used as a reference document, and uh, I believe this was helpful to facilitate the awareness and adoption of related intervention by MSD. And for that, basically, we collated the entire, whether you talk about the acts, regulation, or the social security schemes and policy, all that all together we put. And we create a kind of compendium which provides all the details right from who could be the potential beneficiaries, what are the eligibility criteria, what kind of supports and benefit can be given to them. And so this document, we believe, was used as a reference a guide, which facilitated MST in terms of creating awareness and adoption among the selected community. So firstly, I will talk about the acts, regulation, and policies, and then this will be followed by the relevant social security schemes. So there are various number of like acts and regulations. So to start with, there is the Air Prevention and Control of Pollution Act 1981. So this act basically mandates establishment of a state and central pollution control board. This act also basically direct regulatory authority to prescribe air quality standard and methods to measure it. Then there is NAMP Act, National Air Quality Monitoring Act, which is again administered by the Central Pollution Control Board. And under this, 804 air quality monitoring stations across 340 cities and towns are installed. Then there is an NCAP 2019, which envisages about the reduction of PM10 level by 40%, which is the target by to be achieved by 2025-26. And 131 cities have been included in this, with establishment of a network of air quality monitoring station and capacity building of relevant stakeholders and creating public awareness program under this. Then there is a graded action plan, which was basically implemented in 2017. And this is a kind of like emergency measures. And we all know that this is basically implemented in 4 stages, depending upon the severity of the air quality, air pollution. And various actions are taken, which basically ranges from a garbage ban on garbage burning, and brick lanes, and finally like a ban on construction activity, which eventually basically impact the construction workers. But one thing which we have observed, that while the this GRAP is designed to improve air quality and protect public health, its impact on informal workers can be mixed, primarily because, as I mentioned, when in the final stages, we have seen most of the time that there is a ban on the construction activities and various other activities. So eventually that impacts their livelihoods. So there is a positive side, but there is also a flip side of it, which is basically impacting the livelihood of the informal community by this. Then there are several other uh, 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 acts and regulation, primarily which is safety related or health related with. So there is health, safety, health and working condition code 2022, which basically aims at addressing issue related to occupational safety and hazards by outlining the responsibility of the employers. And but what we have observed that uh, some important provision is missing in this. For example, creche facility for construction workers, and the basic protection against occupational hazards such as provision of masks are not being met under this particular code 2022. Then there is the building and other construction workers regulation 1996. This is basically this legislation basically aims at regulating the employment and working condition of construction workers in the country through registration, provision of welfare measures, and licensing of contracts and enforcement of penalties for violation of provision. Then there are solid management rules 2016. And then there is again the code on social security 2022. So this code basically brings unorganized sector workers, including gig workers and platform workers, under the ambit of social security scheme. which includes life and disability insurance, health and maternity benefits, pension, etc. And so in our experience, what we have observed that registration of migrant workers is often not done under this due to their transit nature of their work. So, and that's the reason they are basically excluded. This basically exclude them from receiving the benefit that is desired for them. So, so there are also various social security scheme implemented by union government as well as the state government. So these schemes basically are related to health, livelihood, safety at workplace, WAS, and so and broader social welfare scheme like pension scheme, etc. So our landscape study try to dive into the schemes, benefits, eligibility criteria, and all that. So while several schemes have been documented in the study, but and they are broadly covered the informality of work, and they basically did not address the disproportionate impact of air pollution on these workers. So there are schemes, but there are some gaps which we are talking about. And so if I talk about some health related scheme, health and gender related scheme, so there are schemes which basically broadly cover health insurance, life insurance, and accidental insurance. And there are some other schemes as well, for example, prenatal and antenatal care, and providing financial assistance as well as supplementary screening, etc. Daycare facility for children between 6 months to 6 years, whose mothers are engaged in paid labor, especially in informal sectors. So these are although some of the schemes under the health category. And there is a provision of financial assistance to economically weaker section for treatment of life-threatening illness. So these are some of the schemes which are available for the health workers, the informal workers, and but there are some missing element in this, which we believe that should be included. For example, disability insurance should also talk about the chronic illness that are developed as a result of greater exposure. But as of now, this is not included. Similarly, healthcare scheme that focuses on pregnant and lactating women should place particular emphasis that long-term exposure to air pollution has on health of both mother and child. And screening, for example, can include a lens that looks at the impact of air pollution on overall health. Then there are schemes related to livelihood and skilling. There are schemes for construction work, those who are engaged in street vending or waste management activity. And there are some specific schemes that provide financial assistance to small income generating activities, and self-employed women have also been introduced in that scheme. And there is recently the e-Shram portal was introduced, which aims to create a one-stop basically database for informal workers. And this portal is basically creating a comprehensive database of workers, those who are in organized sector. And this was basically to enable smooth access to social security benefits and welfare schemes. And job opportunity, pension scheme, skill building opportunity, and digital trainings are available on that portal. So as I mentioned, there are acts, regulation, and there are schemes and policies, but there is no single framework that focuses on the intersection of air pollution and informal workers. So that direct focus and direct linkage is basically missing there, which I highlighted that should be included at least, and that in all the schemes. So if we talk about the policies or schemes and acts guidelines that address the need of informal workers, these do not basically account for the disproportionate impact that air pollution has on health, livelihood, and overall well-being. So these are the things that could be considered. So while there are schemes, social security scheme and policy for the benefit of informal sector workers, but there are certain challenges which they encounter, and this we have learned through various literature review as well as this we witnessed when we did the baseline survey and inline survey for Mahila Housing Trust. And some of the regions which was basically reported to us was the main reason was the lack of information, that there are schemes, but they don't know which are the schemes, what are the criteria, how they can avail the benefits of the scheme, what are the documentary proof that they need to produce to avail the benefits. So lack of awareness was one major thing, but thankfully, and it's a very positive sign that we when we conducted the inline, so while in baseline, nearly 70%, 69% precisely, respondent informal community members were they did not avail the scheme just because they did not have the knowledge and information about that, which has reduced down to 33%. That means that MST intervention has at least created awareness among this community, like what are the schemes, how you can avail the benefits, what are the documentary proof that you need to produce for that. And they are not just focused on awareness building, they have also facilitated the access to the scheme. And for that, the very essential thing right from the beginning, which was basically the lack of the necessary documents, identity proof. So to facilitate the creation of new Aadhaar card for those who did not have, or those who possessed the Aadhaar card but it was not updated. So updation of Aadhaar card plus creation of new card, e-Shram card. So MST have supported this community in having these necessary documents. And I think eventually that will benefit them in getting the access of these schemes in longer run. Yeah. So that's all.
Thank you, Gajendra ji, for sharing findings of the landscape study. It was really insightful. Now I would like to welcome our last but not least panelists, Miss Hemlata Ben and Miss Zarina Begum. बट हम सबसे पहले शुरुआत करेंगे हेमलता बेन से। हेमलता बेन, आप अपने परिचय के साथ अपने काम का अनुभव आप शेयर कर सकते हैं। आप म्यूट पर है। हेमलता जी, आप म्यूट पर हैं। हाँ जी।
सबसे पहले आप सभी का बहुत बहुत धन्यवाद। मेरा नाम हेमलता बहन है और मैं नन नगरी डी ब्लॉक से प्रतिभा महिला मंडल अध्यक्ष के साथ साथ मैं AQI एम्बेसडर भी हूँ। AQI क्या होता है, इसे कैसे मापते हैं, ये पहले मैं कुछ नहीं जानती थी, लेकिन फिर मुझे महिला हाउसिंग ट्रस्ट के द्वारा जो कार्यकर्ता हैं उनके द्वारा मुझे इसकी ट्रेनिंग दी गई। उसमें मुझे बताया गया कि वायु को कैसे मापा जाता है, कैसे इसकी गुणवत्ता को मापा जाता है। हमें इस तरह का बॉक्स दिया गया, आपको बॉक्स नजर आ रहा है सबको? बॉक्स दिया गया और अब मैं अपने एरिया में जाती हूँ और जगह जगह इस बॉक्स को रखकर लोगों को बताती हूँ कि ये वायु नापने का बॉक्स है। सबसे पहले जब मैंने अपने एरिया में इस जगह पे इसको रखा तो एक भैया कहते हैं भाई इसमें रेड कलर की लाइट आ रही है, ये तो बम है। दूसरे भैया कहते हैं नहीं भाई इसमें लाइन जल रही है, ये एक कैमरा है। फिर मैंने उनको समझाना शुरू किया, मैंने कहा ना तो ये कैमरा है, ना इससे डरने की जरूरत है, ना ये बम है, ये है एक वायु की गुणवत्ता को जांचने वाला मॉनिटर। इसमें जो तीन तरफ जो नंबर आ रहे हैं, जैसे कि आप यहाँ देख सकते हो PM 2.5, ये वो कण है जो कि तार जलाने से, प्लास्टिक जलाने से या किसी गंदे वंदे कपड़े जो होते ना लोग, उसको जलाने से जो धुआं निकलता है, वो एक बहुत छोटे छोटे कण होते हैं जिसे हम सूक्ष्मदर्शी कहते हैं ना, स्कूलों में देखते हैं मैग्नीफाइंग ग्लास जो होता है, उससे कई बार देखने के बाद भी नजर नहीं आते। ये वो कण होते हैं जो हमारे सांस के द्वारा हमारे शरीर में जाते हैं और खून में जाकर घुल जाते हैं और हम लोगों को स्किन में जलन, आंखों में जलन और कैंसर जैसी बीमारी देते हैं। उसके बाद बताती हूँ ये PM10, ये भी इसी तरह का बहुत छोटे से छोटा कण है। ये जो है, जो जैसे भी थोड़ी देर पहले हमें पिक्चर्स में दिखाया गया कि जो धूल उड़ रही थी, जैसे पत्थर को काट रहे थे, जो धूल थी, ऐसे मान लीजिए कहीं घर बन रहा हो, सड़क बन रही हो, जहां ज्यादा धूल मिट्टी का इस्तेमाल होता है, वहां पर ये कण बहुत ज्यादा पाया जाता है। और ये भी हमारे शरीर में अंदर जाकर सीधा हमारे फेफड़ों पे चिपकता है और हमें खांसी, अस्थमा जैसी बीमारियों से ग्रस्त यानी बीमारियां देता है हमें। साथ ही उनको बताती हूँ भाई ये सब चीज जो भी है ये कभी कभी कम, बढ़ना, ज्यादा, कम होता रहता है। ये है वायु को ये वायु को मापती है कि कितना कम कितना ज्यादा हो रहा है। जो लोग नहीं, मतलब जो पढ़े लिखे हैं वो समझ जाते, जो नहीं समझ पाते उनके लिए मैं इस रंगों का भी प्रयोग करती हूँ। साथ ही ज्यादा से ज्यादा लोगों को जागरूक करने के लिए हम लोगों ने रैलियां भी निकाली, पैम्पलेट भी बांटे हैं और हमने गलियों में, घरों में बहनों के साथ अधिक से अधिक मीटिंग भी की, ताकि हम ये वायु प्रदूषण के बारे में उन लोगों को अधिक से अधिक जानकारी दे सके। इसी के साथ हमने उन लोगों को EVRS कॉल होती है, उसके द्वारा भी जागरूक करने के लिए, जैसे कि उन बहनों के पास फोन आता था, फिर उस टोल फ्री नंबर पे वो फोन करती थी बहनें, और उसमें हर 15 दिन बाद एक नई स्टोरी, जैसे उसमें नालियों से संबंधित, कूड़े या इन चीजों से संबंधित नई नई कहानियां आती रहती थी। उसी के साथ साथ हम, क्या नाम है, मॉनिटर के साथ साथ मॉनिटर को दिखा के तो हम इनको जागरूक करते करते हैं। और लोगों को हम उनको ये समझाते हैं कि भाई हम पोल्यूशन खत्म तो नहीं कर सकते, लेकिन अपने आस पास के पोल्यूशन को कुछ कम करने की कोशिश तो कर सकते हैं। इसी के तहत हमने हेल्थ कैंप लगाया। हेल्थ कैंप में हमने लोगों को ले जाकर डॉक्टरों के द्वारा उनका हेल्थ चेकअप कराया। साथ ही में हमने वहां पर कुछ ऐसे पौधे रखे जो कि हम घर के अंदर भी लगा सकते हैं, जो हमारी हवा यानी वायु को शुद्ध करते हैं। और कुछ ऐसे प्लांट जैसे कि भाई एक हो गया मनी प्लांट, स्नेक प्लांट और तुलसी, कुछ पौधे, सॉरी मैं उनका नाम भूल रही हूँ। ऐसे पौधों को घर में लगाने से क्या होता है कि हमारी वायु शुद्ध और साफ होती है। साथ ही में हमने उनको चारकोल बैग के बारे में बताया। हमने उन लोगों को मास्क भी बांटे कि जब भी आप घर से बाहर जाएं तो प्लीज मास्क लगा कर जाएं, अपनी सेहत का ध्यान रखें। एयर प्यूरिफायर भी बताया, जो कि पंखों में भी लगाया जाता है, इसके बारे में जानकारी दी। और लोगों को ये बताया कि आज के टाइम में वायु प्रदूषण जो है एक बहुत ही गंभीर मुद्दा है। जैसे कि आप लोगों को शायद याद होगा, कहते हैं ना कि हम लोग बिना पानी और बिना खाए शायद हम कुछ सेकंड, मिनट, घंटे रह सकते हैं, लेकिन बिना शुद्ध हवा के हम लोग नहीं रह सकते। इसका नतीजा तो अभी आपने 1-2 साल पहले जब कोरोना काल में सभी ने भुगता है। सभी को पता है कि शुद्ध हवा मिलनी भी भारी पड़ गई थी। तो हम लोगों को कोशिश करते हैं हम लोग कि हम वायु प्रदूषण के बारे में ज्यादा से जानकारी लोगों तक पहुंचाएं, और हमारी मेहनत काफी हद तक तो रंग ला भी रही है। अब कुछ लोग चारकोल बैग का इस्तेमाल भी करते हैं, रूम हीटर का भी इस्तेमाल करने लगे हैं, थोड़े बहुत पौधे भी लगाना स्टार्ट कर दिया है लोगों ने। और सबसे जरूरी बात, जब हमने हेल्थ कैंप लगाया था तो साथ ही हमने उनको कुछ सरकारी योजनाओं से भी जोड़ा था, ताकि अगर भविष्य में कोई परेशानी आती है तो उनके जो डॉक्यूमेंट्स है, जब वो लेबर कार्ड हो, आधार कार्ड हो, ई श्रम कुछ भी हो, हमने उनको अपडेट कराया। उन लोगों को बताया कि कोई कमी है तो आप हमारे कैंप में आइए, अपने अपने कार्ड्स अपडेट कराइए। लोगों ने काफी संख्या में अपने कार्ड्स वगैरह अपडेट कराए हैं। और जैसे सब लोग अब थोड़ा थोड़ा समझने लगे हैं, इसी के साथ क्या नाम है, कुछ लोगों ने अब चारकोल बैग का इस्तेमाल किया है, पौधों का इस्तेमाल भी किया है। और सबसे थोड़ा सा मुझे थोड़ा सा अच्छा लगा कि लोग मुझे हेमलता के नाम से तो जानते थे, हेमलता बहन, लेकिन अब मुझे ना दूर से आवाज लगाई जाती है, ओ वायु मित्र। ये मेरी शायद प्लस पॉइंट है। थैंक यू।
बहुत बहुत धन्यवाद हेमलता बेन, आपने बहुत अच्छी तरीके से अपनी सारी चीजें बताई। बट एक चीज जो बहुत इंपॉर्टेंट थी, क्योंकि आपका एक जो रोल है, आप एक एम्बेसडर हो, आपको बस्ती में जाके लोगों को जागरूक करना है। बट बाहर की दुनिया को ये नहीं पता होता है कि लोगों को जागरूक करने में भी क्या दिक्कतें आती है। आपने बहुत अच्छे से समझाया कि जब आप पहली बार मॉनिटर लेकर गए तो लोग ये समझने लगे कि आप बॉम्ब लेकर घूम रहे हो या आप कैमरा लेकर जा रहे हो। तो हम समझ सकते हैं कि बस्ती में जाके लोगों को इस विषय की जानकारी देना ही बहुत चैलेंजिंग है। जो काम आप बहुत अच्छे तरीके से कर रहे हो, तो आपका काम काफी प्रशंसनीय है। अब मैं बुलाना चाहूंगी जरीना बेगम जी को कि जरीना बेन, आप अपने एज ए सीएजी लीडर और एज ए इको एम्बेसडर आप सावदा गेवरा में किस तरह से एक्टिविटी करते हो और क्या क्या दिक्कतें आपको आती है? जरीना बेन।
सभी को मेरा नमस्ते। मैं जरीना सावदा जेजे कॉलोनी डी ब्लॉक से हूँ और मैं एमएसटी से 10 साल से जुड़ी हुई हूँ। एमएसटी में जुड़कर मेरी एक अलग पहचान बनी। फिर उसके बाद हमने अपना एक सीएजी मंडल बनाया जिसका नाम दिशा महिला मंडल है और मैं उसकी अध्यक्ष हूँ। फिर हमने उसको रजिस्ट्रेशन कराया। फिर हमने निगम पार्षद जी, विधायक जी और एमसीडी नरेला जाकर हमने शिकायत पत्र दिए साफ सफाई को लेकर। हमने अपने एरिया में साफ सफाइयाँ करवाई, जगह जगह कैमरे भी लगवाए और जहाँ अंधेरे वाले पॉइंट थे वहाँ लाइटें भी लगवाई। कुछ बहनों की पेंशन करवाई और 2-3 लड़कियों की शादियाँ जो कि हो रही थी लेकिन उनके घर खाने का इंतजाम नहीं था, वो निगम पार्षद जी से कहकर खाने का इंतजाम भी करवाया और उनकी शादियां हुई। इस तरीके के काम हमारे देखकर विधायक जी को बहुत अच्छा लगा और उन्होंने हमें प्रशंसा पत्र और सम्मान पत्र भी दिए। उसके बाद मैं अपने एरिया में AQI का काम देखती हूँ जिसमें मैं वायु मित्र हूँ। वायु मित्र का काम है AQI मॉनिटर से एरिया में वायु की गुणवत्ता को जांचने का काम कर रही हूँ। मैं अब मीटिंग लेती हूँ और मीटिंग के माध्यम से बहनों को समझाती हूँ कि वायु प्रदूषण जो है वो इतने छोटे छोटे कण हैं जो हमें दिखाई नहीं देते, लेकिन हमारे इस मॉनिटर के अंदर हम अपने आसपास की वायु की गुणवत्ता को माप सकते हैं और इसके अंदर ये दिखाई देती है। तो कुछ बहनों ने बताया कि ये जो मतलब नंबर आते हैं तो हम इसको तो मतलब पढ़ नहीं पाते, हमें पढ़ना नहीं आता है, तो हम कैसे समझ पाएंगे इसे। तो फिर मैंने उन्हें बताया कि ये कुछ कलर दिए हमारे इस पे दर्शाए गए हैं, तो मैं इस कलर के माध्यम से आपको समझाती हूँ। तो हमारे ये कलर जो है ना, इन कलर के माध्यम से उन बहनों को जल्दी समझ में आया। तो जो मैंने बताया कि जैसे ये हरा कलर है, तो ये हरा कलर हमारे लिए मतलब अच्छा, बहुत अच्छा, हमारे आसपास का वातावरण बिल्कुल शुद्ध है। उसके बाद फिर ये हल्का हरा, हल्का हरा का मतलब है कि थोड़ा सा प्रदूषण है। फिर उसके बाद ये पीला कलर है, पीले कलर में प्रदूषण थोड़ा थोड़ा बढ़ना शुरू हो गया। फिर ये नारंगी कलर आता है, तो इससे पता चलता है कि अब हमारे आसपास प्रदूषण होने लगा। फिर ये रेड कलर, जब रेड कलर अगर हो जाता है तो समझिए हम खतरे में हैं और प्रदूषण बहुत ज्यादा हो चुका है, अब ये हमें नुकसान देगा। कलर के माध्यम से लोगों को समझाना आसान है और उनकी समझ में जल्दी आता है, और उससे हम कलर के माध्यम से लोग बाग हमसे जुड़ पाते हैं जल्दी। अब मैं एरिया में जगह जगह जाती हूँ और अपना मॉनिटर लेके जाती हूँ। इस मॉनिटर से वायु की गुणवत्ता मापती हूँ और लोगों को, बहनों को बताती हूँ कि हाँ, हमारे आसपास जो वायु प्रदूषण है उसको हम कैसे कम कर सकते हैं और कैसे रोक सकते हैं। जब ये प्रदूषण ज्यादा होने लगता है तो हमें नुकसान देने लगता है, तो इसको रोकने के जो कारण है वो है कि हाँ, जैसे हम आग ना जलाएं, कूड़ा कचरा ना जलाएं। अगर सर्दियों में ज्यादा दिक्कत हो रही है हाथ सेकने, तो हम रूम हीटर का इस्तेमाल करें। आजकल जो है मार्केट में नए रूम हीटर चले हैं, एनर्जी एफिशिएंट हीटर, जो कि ज्यादा महंगे नहीं है और मतलब इससे बिजली का बिल भी कम आता है और हमारी जेब और सेहत दोनों पे प्रभाव देता है। दूसरा है, अगर हम घर से बाहर निकल रहे हैं तो मास्क लगा के निकले। हमने घर घर जाकर मास्क भी बांटे। और उसके बाद एक हमारा है ये चारकोल बैग। ये चारकोल बैग है, इसको हम मतलब घरों में लगाने से प्रदूषण कम होता है। कुछ बहनों ने कहा घरों में तो प्रदूषण होता ही नहीं। हमने कहा नहीं, घरों में भी प्रदूषण होता है और ये हमने सर्च भी किया है। फिर उसके बाद एक पंखे में लगाया जाता है प्यूरिफायर, एयर प्यूरिफायर। तो उससे भी अगर हम पंखे में लगाते हैं तो हमारे जो है, जब पंखा चलता है तो हमारे कमरे का जो प्रदूषण होता है वो अपनी तरफ कैच कर लेता है और हमारे कमरे को शुद्ध हवा मिलती है। तो ये छोटे छोटे जो मतलब हमारे प्रोजेक्ट हैं, इनको हम इस्तेमाल करके अपने वायु प्रदूषण को रोक सकते हैं। हमने इससे चारकोल बैग पे एक सर्च किया। 2 बहनों के घर हमने ये मतलब 2 बहनों को चुना और एक बहन के घर हमने ये चारकोल बैग लगाया, एक के घर नहीं लगाया। फिर अपने AQI मॉनिटर से उनके घर की वायु गुणवत्ता को जांचा। 15 दिन तक हमने लगातार गुणवत्ता जांची। तो जिस बहन के घर में हमने चारकोल बैग लगाया था, उस बहन के घर प्रदूषण नहीं था, और जो दूसरी बहन थी हमारी, हमने उसके घर नहीं लगाया था तो उसके घर का प्रदूषण अधिक था। ये हमने अब सर्च किया और हमें बहुत अच्छा भी लगा और बहनों को भी ये जानकर खुशी हुई कि जो हमारे घरों का प्रदूषण है वो इस चारकोल बैग से कम हो रहा है। उसके बाद हमने देखा कि बहनों को मतलब छोटे छोटे पौधे आते हैं जो इंडोर प्लांट होते हैं, उनको लगाने के लिए भी बोला। उससे भी वायु प्रदूषण पर काफी फर्क पड़ता है। और ये सारी जानकारी मुझे मिली और मैंने लोगों को दी। मुझे बहुत ही अच्छा लगा। इन सभी छोटी छोटी बातों से हम वायु प्रदूषण को कम कर सकते हैं और मुझे एक नई पहचान मिली, जिससे मैं बहुत प्रोत्साहित हुई। धन्यवाद।
धन्यवाद एंड शुक्रिया जरीना बहन, आपने बहुत अच्छे तरीके से एक बात बताई। क्योंकि जो पढ़े लिखे लोग होते हैं उनको तो आप मॉनिटर लेके जाओगे, उसमें आप उनको नंबर पढ़ के दिखाओगे तो समझाना शायद फिर भी थोड़ा आसान होता है। बट जो अनपढ़ लोग के होते हैं उनको समझाना बहुत दिक्कत वाला होता है। और आपने बहुत अच्छे से एक्सप्लेन किया कि आप जो मॉनिटर में दिए गए जो कलर, ऑरेंज, येलो कलर, रेड कलर, आप कैसे उसको समझाते हो। तो ये आपकी जानकारी बहुत ही इम्पोर्टेंट जानकारी आपने दी है कि अनपढ़ लोगों को भी हम इस तरीके से जागृत किया जा सकता है। थैंक यू सो मच जरीना बहन। अब नाउ द फ्लोर इज ओपन फॉर क्वेश्चन आंसर। अभी हम लोग क्वेश्चन एंड आंसर के लिए अभी हम टाइम रखा है तो हम पूछ सकते हैं। अभी हमारे पास वैसे आई वुड लाइक टू आस्क अ क्वेश्चन टू अवंतिका जी। Avantika ji, in your view, what innovative solutions, like both technological and policy-based, hold the most promise for tackling air pollution and particular for vulnerable communities?
So Bhavna ji, according to me, I think first and foremost is that all the stakeholders should come together to work. And it is very important to include the communities. Like if you are talking about vulnerable communities, it is whatever project we implement, it is very important to first discuss with the vulnerable communities whether and also to understand that how is it going to benefit them. And I think it is very important to take some policy level initiatives to learn from the cities which are already doing some good case studies. Like if you would see, there's a new concept of developing low emission zones. Few cities have already doing it, but we still do not have a very successful example. But such kind of studies, in it's very good to do at a small scale. It's good to do at a pilot scale, but it does involves a lot of stakeholders. For example, because we see if we have to develop a low emission zone, then we have to deal with or discuss with stakeholders from road department, or we have to discuss with stakeholders from municipal corporations, because you'll definitely have to make some changes. If you have to maybe you have to do some route planning, maybe you have to divert the traffic. So I think stakeholder engagement is very important, and it is always best to do at a small scale first. Say if low economic zone, if we are saying low emission zone, it is always best to do at a small scale, and if that is successful, it is good to learn know the learnings from it, and then it should be scaled up at a bigger scale. But engagement with communities is very important, and I'm really very happy to see what Hemlata ji and Zarina, when they discussed, I think this is how community engagement should be there. It is not always possible to go house to house, but if we are involving people from the community, it becomes really very easy, and the impact is it's more as compared to if we are not working with communities. Yeah. Yeah, I think, yeah, I hope I answered your question.
Yes, yes. And I have another question to you only. What policy measures or incentives can the government introduce to encourage industries, particularly those operating informally, to adopt greener policies?
Yeah, so I think maybe government already has, but some policies, like if you the way how we discard our waste, or how we discard our if the industries which are causing pollution, maybe water pollution also. So some kind of incentives, that if we are if they are treating their wastewater, or if the way they are treating their waste, how where is it going? But I guess the smaller scale industries, the household industries, they're not able to segregate, or they're not able to treat that in a proper manner. But if some incentives the government is giving to them to encourage them, and or also teaching them that how that could be reused, or what use can be done after it has been used, giving them some incentives that this could be reused, or helping them to tie them with some other stakeholders, like if it's a recycling thing, that I think will definitely help to those kind of policies, or those kind of incentives will definitely help them to earn also, and also to tackle the waste. Yeah.
और दूसरा एक सवाल ये था कि जो सेंट्रल गवर्नमेंट होता है वो किस बेसिस पर ये ग्रांट देते हैं, मतलब उसका कैटेगराइजेशन कैसे होता है? जैसे एग्जांपल के अहमदाबाद का अगर बात करें तो अहमदाबाद का एयर पोल्यूशन के लिए बजट 500 करोड़ का अलॉट किया गया था। आई एम नॉट श्योर अबाउट द अदर स्टेट्स, बट वो जो किस कैटेगरी से उसको ये ग्रांट का अलॉटमेंट होता है, वो अगर आपको कुछ आइडिया हो तो भी
हाँ,
आप शेयर।
बेसिकली वो डिपेंड करता है पॉपुलेशन पे, पॉपुलेशन साइजेस पे।
ओके।
या और बट लेकिन जब एन कैप का था, तो उस टाइम पे नॉन अटेनमेंट सिटीज़ आइडेंटिफाई करी थी। तो नॉन अटेनमेंट सिटीज़ वो थी कि जो हमारे जो एयर पोल्यूशन इंडेक्स होना चाहिए 5 years तक, जिन सिटीज़ ने वो मीट नहीं किया था, उनको नॉन अटेनमेंट सिटीज़ की कैटेगरी में इंक्लूड किया था। तो वो अराउंड 132 सिटीज़ थी, लेकिन ये 2019 के आसपास ये सिटीज़ आइडेंटिफाई हुई थी। लेकिन उसके बाद में बहुत सारी ऐसी सिटीज़ ऐड हो गई हैं जिनका एयर पोल्यूशन जो AQI है बहुत हाई हो चुका है। बट अब होपफुली, क्योंकि ये 5 years का था, अब नेक्स्ट स्टेप जब गवर्नमेंट लेती है, होपफुली कि नई सिटीज़ या कुछ और इंसेंटिव्स या फंडिंग ग्रांट्स गवर्नमेंट इंट्रोड्यूस करेगी, जिसमें दूसरी सिटीज़ को भी इंक्लूड किया जाएगा।
और दूसरा ये भी पूछना था कि लो कॉस्ट और हाई इम्पैक्ट वाले किस तरह के सॉल्यूशंस हम प्रमोट कर सकते हैं, क्योंकि जो हेमलता जी ने बताया और जो जरीना बहन ने बताया वो हाउस होल्ड लेवल पर तो हमारे पास कुछ सॉल्यूशंस है, बट अगर सिटी लेवल का अगर हमें कोई ऐसा सॉल्यूशंस लाना हो तो किस तरह के सॉल्यूशंस अब, क्योंकि जब तक हमें पता है कि अहमदाबाद की बात करें तो मैक्सिमम जो बजट दिया गया है उसको रोड के लिए ज्यादा वो लोग यूटिलाइज करते हैं वो ग्रांट को, बट सिटी में रोड के अलावा भी काफी सारे चीजें हैं जिसकी वजह से सिटी का पॉल्यूशन बढ़ता है। तो उसके लिए क्या कोई आपके नॉलेज में कोई ऐसे सॉल्यूशंस अवेलेबल है जिसको सिटी अडॉप्ट कर पाए?
हाँ, मेरे ख्याल से भावना जी, जैसे मैं अपनी प्रेजेंटेशन में बता रही थी कि एयर पोल्यूशन को हम यूजुअली रिलेट करते हैं मोबिलिटी सेक्टर से या सॉलिड वेस्ट सेक्टर से, बायोडाइवर्सिटी, हॉर्टिकल्चर मतलब प्लांटेशन, उनसे हम उसको रिलेट ज़्यादा करते हैं। और आपकी बात बिल्कुल सही है कि ज़्यादा हमारी सिटीज़ का जो फोकस है वो रोड्स पर रहता है या डस्ट को रिड्यूस करने में रहता है। पर मेरे ख्याल से अगर हम छोटी-छोटी एक्टिविटीज़ जैसे सॉलिड वेस्ट है, उसको मैनेज करने में अगर हम घरों में जाकर कुछ कम्युनिटी एंगेजमेंट करके सॉलिड वेस्ट को कैसे मैनेज करते हैं, वेस्ट को इनफैक्ट वेस्ट को कैसे मैनेज करते हैं, तो उसमें अगर वो वेस्ट हमारा लैंडफिल्स पे नहीं जाएगा, हम उसको कंपोस्ट में बना लेंगे या कुछ रिसाइकिल हो जाएगा, तो ऐसे स्टेप्स बहुत इंपॉर्टेंट हैं। ये बहुत सारी सिटीज़ कर भी रही हैं, बट अगर हम पूरा स्ट्रक्चर पढ़ें वेस्ट मैनेजमेंट का, ये बहुत ही टफ स्ट्रक्चर है। अगर हम दिल्ली
यस
का
यस
भी
यस यस
तो इसमें बहुत सारे स्टेक होल्डर्स इन्वॉल्व हैं, बट छोटे स्टेप्स लेने से डेफिनेटली इम्पैक्ट पड़ता है। उसके अलावा जो हम ट्री प्लांटेशन करते हैं, जो हमारा
जी जी
एक्सपीरियंस
या प्लांटेशन।
हाँ, हमारा एक्सपीरियंस ये रहा है कि जो बहुत सारी सिटीज़ उन ट्रीज़ पे फ़ोकस करती हैं जो नेटिव स्पीशीज़ होती ही नहीं है, बस वो देखने में सुंदर लगती हैं, तो इसलिए उनका प्लांटेशन हम लोग कर देते हैं सिटीज़
जी
में।
जी
बट अगर हम बड़े ट्रीज़ का प्लांटेशन कर रहे हैं, जो वहाँ के नेटिव हों, जो एयर क्वालिटी अब्ज़ॉर्बेंट एपीटीआई करके हम उसको कहते हैं, तो अगर उनका इंडेक्स ज़्यादा हो तो वो एयर पोल्यूशन कंटेंट है उसको ज़्यादा अब्जॉर्ब कर सकते हैं। उससे डेफिनेटली ऐसे कुछ इनिशिएटिव्स लेने से, अवेयरनेस क्रिएट करने से, स्कूल्स में अवेयरनेस या इवन कम्युनिटी लेवल पे अवेयरनेस करने से डेफिनेटली फ़र्क पड़ता है।
Okay. Thank you, Avantika ji. I would request all participants, if you have any questions, then you can mail us. We would be very happy to respond via email. Now, as we conclude today's webinar, a special thanks to our speakers for their valuable insights, to Mahila Housing Trust and Purpose for their leadership, and to the Clean Air Fund for their support. Thank you to all of you who joined us today.
ભાવનાબેન
Yes.
બધાને કોને એકવાર એમનો કેમેરો ઓન કરી લે તો આપણે સ્ક્રીનશોટ લઈ લે.
Yes, yes. I'm requesting, could you please open your camera? 1 मिनट के लिए हम लेना चाहते हैं सबका एक ग्रुप फोटो. So is it possible to? Yes, Chetna. So yes, finally, thank you to all of you who joined us today. Your commitment to this cause is crucial as we work together towards healthier and cleaner air communities. Let's carry forward the momentum from this discussion and continue to make a difference. Have a great evening, and we look forward to seeing you at future events. Thank you. Chetna, now you can click the photo.
Thank you.
Yeah. Thank you, all of you. Thank you.